Hello, and welcome to today's webinar, Recovery from Substance Use Disorder, How Employers and Caregivers Can Support. Thank you for joining us as we recognize September as National Recovery Month. This is a time to celebrate the strength and resilience of those who are walking the path of addiction recovery and empower communities to continue to foster empathetic and supportive environments, particularly in the workplace. My name is Marvell Adams Jr., and I serve as CEO of Caregiver Action Network. I'm honored to be here today to continue the vital work of the Families, Addiction, and Mental Health Network, or FAM, in supporting caregivers, individuals, and families as they navigate the complex mental health and substance use disorder landscape. Today's webinar, we will focus on a critical piece of recovery journey, the workplace. As more than two-thirds of individuals living with a substance use disorder report being employed, employers play a pivotal role in supporting individuals in recovery. Stable jobs provide individuals with purpose, structure, and financial independence, which are critical for sustained recovery. Caregivers, too, face unique challenges for caring for loved ones with substance use disorders. However, persistent stigma and institutional barriers can make it difficult to gain or maintain employment. The benefits to supporting and keeping individuals in recovery are tangible in both community health outcomes and economic factors. In fact, we know from recent research that innovative treatments like behavioral therapy combined with long-acting injectables for opioid use disorder can save nearly $300,000 per case compared to the behavioral therapy alone. To explore these topics further, I'm joined today by experts in workplace safety, labor, and recovery. First, you'll hear from Ryan Hampton, recovery advocate and co-founder of Mobilize Recovery, who will share more about his organization's work and the important role innovation and treatment play in recovery. During our panel discussion, we'll hear from labor leaders at the National Safety Council, Michigan Works Association, and Keystone Contractors Association. As these advocates, experts, and leaders will highlight, by working together, we can address the stigma of treating substance use disorders like the chronic health condition that it is and empower individuals and families navigating recovery. With that, I'd like to welcome Ryan Hampton.
Thanks so much, everyone, for inviting me here today. It's truly an honor to be with you. My name is Ryan Hampton. I'm an advocate, an author, nonprofit founder. I'm a husband, a dog parent, but most importantly to me, I'm a person in long-term recovery, which means that I haven't felt it necessary to have a drink or a drug or any mood or mind-altering substance since February 2nd, 2015. I want to start by extending my deepest gratitude to the hosts of this webinar, the Caregiver Action Network, and the Families, Addiction, and Mental Health Network. Your work is not just important, I believe it is life-changing. You're on the front lines, supporting families and individuals in a way that is so essential and oftentimes goes unnoticed. So today we're here to celebrate National Recovery Month, my favorite month of the year, September. For me, this month isn't just about a concept, it's about a living and a breathing reality. It's about people. It's about hope. It's a testament to the fact that recovery isn't just possible, it's happening every single day in all of our communities. My own journey with addiction began with a prescription for pain medication after a hiking injury. And like so many others, what started as a legitimate medical need quickly spiraled into a decade-long battle with opioid addiction and heroin. For a long time, my life was a cycle of hospitals, institutions, and near-fatal overdoses. I can remember sitting in my car, looking at the city lights, feeling completely and utterly alone and feeling like there was no way out. The stigma around my health disease, my health condition, was crushing. I was convinced so many times that I was a moral failure, that my struggle was some sort of weakness of character rather than a chronic healthcare condition. But then, luckily, something did shift. I found my own pathway to recovery, and for the first time in a decade of chaotic drug use, I saw a future for myself. I got help, and I leaned on the support of others who understood my struggle. That's when my life truly began. I realized that my story wasn't just my own, it was part of a larger, shared collective experience. I found my voice in recovery advocacy, and that passion led me to begin something called Mobilize Recovery, Mobilize Recovery is a national nonprofit that has one simple mission: to connect people in recovery and allies of recovery with the resources that they need, to empower advocates who are on the front lines, and to show the entire country that recovery is possible and recovery is worth investing in. One of the most powerful things that we can do, and a core part of our work at Mobilize Recovery, is to combat the stigma, to combat the shame that surrounds addiction. It is a silent killer. It prevents people from seeking help and it isolates families. It tells people that they are unworthy of care. We have got to change that narrative, and we have got so far to go despite all the work that we have done over the last several years. We have to talk about addiction not just as a moral failing, but as a public health issue. We need to replace judgment with empathy and isolation with connection and community. And I believe that this is where caregivers come in. Caregivers are the true heroes of this journey. They're the ones who stand by us. They're the ones who navigate the complex and oftentimes confusing healthcare systems. They are the ones who offer a hand to hold when we feel like we're drowning and there's no way out. Your role is invaluable, and your dedication is what truly fuels this recovery movement. We have to make sure you have the resources and support that you need to. Now, in order for recovery to truly thrive, we've got to improve our systems and access to care. This definitely includes medication-assisted treatments, which have been proven to be highly effective, but still face their own stigma on their own, sometimes in the recovery community and sometimes outside the recovery community. We've got to break down the barriers that prevent people from getting the help they need, whether it's a lack of insurance coverage, a shortage of providers, or a complicated prior authorization process. And I must say, I am so incredibly optimistic about the recent and future treatment innovations happening in both the private and public sectors. The development of long-acting injectables for opioid use disorder is a game changer. These medications can help stabilize individuals, reduce cravings, and prevent recurrence of use. But they're only effective if people can actually get them. We need policies that support the use of these life-saving, effective treatments and make them available to everyone and anyone who needs them. We have got to push for public funding and for policies like those being advanced in states like Michigan that break down barriers such as prior authorizations. You know, at Mobilize Recovery, we have seen firsthand what's possible when we do come together as a community. We've organized caravans that have traveled around the country, uniting people in recovery, advocates, and families. We've provided support and resources to hundreds of thousands of people across the United States. We've gotten over 1 million free doses of Narcan on the ground in 24 states. We've shown that when we work together, we can create a movement that is powerful enough to change lives. So in closing, I want to leave you with this thought. Recovery is not a destination. It is a continuous journey. It's about finding hope in the darkest moments and using your voice to help others find theirs. To the caregivers, the advocates, and the individuals on their own recovery journeys, your courage and resilience are inspiring. Keep fighting, keep advocating, and keep believing in the power and connection of community. I want to say Happy Recovery Month, everybody. Thank you for the work that you do, and thank you for welcoming me here for a few brief moments today.
Thanks for joining us today for this conversation that Caregiver Action Network is hosting around recovery-friendly workplaces, the role of family caregivers, specifically around substance use disorder. Excited to be joined here by my colleagues across the space. We'll go around and do a quick round of introductions. As I said, my name is Chance Browning. I'm lead strategic partnerships here at Caregiver Action Network, and we're excited to be convening this conversation. Claire, I'll toss it over to you to introduce yourself and tell us a little bit more about National Safety Council.
Sure. Hi there, everyone. Great to be here with you all for this conversation. My name is Claire Bryant. I work at the National Safety Council and I manage our workplace well-being initiatives. If you're not familiar with National Safety Council, we've been around for over 100 years and workplace safety is really our bread and butter. And our mission is to save lives from the workplace to any place. So that's the heart of what we do. And my central focus within our organization is focusing on topics that intersect with total worker health. And this area on the topic of substance use disorder and the impact of recovery and the power of recovery is really a really passion that I have in this area. We've done a lot of work in this space. So I'm excited to share a little bit more about that in this conversation.
Great. Good to have you. Ryan, I'll toss it over to you next.
Thank you, Chance. Great to be here today. Hi, everybody. My name is Ryan Hunt. I'm the CEO with the Michigan Works Association. We represent the 16 local workforce development boards across the state of Michigan. Annually, those 16 local workforce development boards provide almost 1 million unique services to job seekers across all 83 counties in Michigan. We also serve over 48,000 employers. Our role as a state workforce association is to support those local workforce development boards through advocacy, professional development, and brand visibility.
And over to you, John.
Hey, how's it going today? Thanks, Chance, to you and your team for having me. I'm John O'Brien from the Keystone Contractors Association. We are a commercial construction trade association based in central Pennsylvania in the Harrisburg area. And we have construction company members kind of sprinkled throughout the state of Pennsylvania. And like I said, we're commercial, so the bigger structures, the schools, federal buildings, office buildings. And we're real involved with labor relations. We have strong relationships with our union partners and all of our contractor members and their workers. And a construction company is nothing without its workforce. So we're very protective and always helping our workforce through issues. And I'm glad to be here today. Looking forward to it.
Yeah, awesome. I think today's conversation, we really want to think about through two lenses, both the workforce and what can be done to create these recovery-friendly workplaces, and also the role of the family caregiver in supporting that of both the employer and their family members. So Claire, I'll start with you. Can you talk to me a little bit about some of NSC's leading programs to support employers and employees in creating and maintaining these recovery-friendly workplaces?
Sure, happy to. NSC has been involved in addressing the overdose crisis since 2012, so a lot of our programming has really shaped and shifted over those years. And so most of that time, we've really focused a lot on just providing simple education on what substance use disorder is, and really the impact that it can have on the workplace, and also how the workplace in turn can influence substance use disorders and substance misuse, namely through injury risk and also psychosocial hazards, high stress, high burnout type of environments, especially common in a lot of the industries that we serve that are more safety critical in nature. So that's been really a common theme throughout our work, but particularly through the last maybe 6 or 7 years, we've been building in intentional programming to create free resources on the topic of recovery supportive or recovery friendly, recovery ready, whatever you want to call it. It kind of varies depending on the person and the program, but really to amplify that messaging and to help spread awareness to what these resources even are. We've done a lot of research at NSC to really understand from employers and employees on their perceptions, different topic areas, opportunities, and gaps related to different safety topics. And we found through that research that only about 24% of employers have a recovery supportive environment from their point of view. So we know there's just a lot of education that needs to happen on what these programs entail, and also the benefit that they can have not only on employee well-being, but also on the safety outcomes within an organization, since that's really our primary scope within this conversation. So that's kind of our general point of view on this and our general effort. I will say we have a few particular resources that I think are worth highlighting for this conversation. One being our workplace wellbeing hub, lots of action-oriented resources for safety professionals on how to actually build these programs, looking at things like fair chance policies, looking at progressive benefit offerings, lots of things that organizations already have that can just be really tailored to better accommodate for individuals who are dealing with substance misuse or have a substance use disorder. So that's a great resource, and it's something that we really like to amplify. Other efforts that are going around all the states and different local programs, because a lot of these resources already exist. We're just trying to centralize them in one place so that it's easy for employers and safety professionals to tap into them. Additionally, I think one really critical component of a recovery supportive workplace is having naloxone available on the job site. And that's where we've really been spending a lot of time and energy the last couple of years. Now that opioid overdose reversal medications, some of them are actually over the counter. So we have free trainings to help employers implement these programs. We just launched a new tool recently that can actually help organizations calculate the amount that they need to better equip their work sites with naloxone, and really focusing on how having naloxone is just like having any other safety tool or emergency response tool that you would have for any other risk that you have in your organization. So really just trying to compare that naloxone should be a standard resource that we're all utilizing for workplace safety. And then lastly, I'd like to highlight, we also have a substance use cost calculator, and this has been one of our resources that's been most highly utilized, especially from partner organizations and employers, to get buy-in for these programs. A lot of folks hit roadblocks when trying to convince their superiors about the importance of addressing substance misuse in the workplace and creating pathways to recovery. And so we hope that this resource really helps to break those conversations down and help to draw attention to the data behind this conversation. I think one of the most important statistics that we've gleaned through that research and through creating that tool is that employers can save about $8,500 every time they help an employee get into recovery. So not only is it the right thing to do, but it's also a cost savings, and there's a benefit to the organization for pursuing that. So generally just trying to draw awareness to all the tools and resources that exist, and also the impact both positively from the employee well-being perspective and from the cost savings perspective.
That's really great context. Ryan, I will toss it over to you for a bit more context on what you're doing at Michigan Works and initiatives to help those in recovery return to work, and any successes or barriers you've encountered. I'll also note for those that are tuning in or watching this after the fact, we'll be sending out these resources and links as follow-ups. So we'll make sure you get those in your inboxes and have access to that. Ryan?
Yeah, I'll tackle the last part of your question first, Chance, regarding barriers to employment. We know that individuals who have, or continue to deal with drug addiction, opioid addiction, oftentimes have significant barriers to employment. And so what we've done here in Michigan, we've been very fortunate to partner with our state's Department of Labor and Economic Opportunity, and also receiving some federal funding. The best example that I could point to, back in 2021 into 2022, 3 of our Michigan Works agencies, primarily in rural northern Michigan, they were able to receive a grant from the federal U.S. Department of Labor that was then also partnership with the Michigan Department of Labor and Economic Opportunity. This was a dislocated worker grant that focused specifically on individuals facing opioid addiction. The great thing about our workforce development system in Michigan is that we use integrated services. So all of the things that one individual may need in terms of employment support and services, those can all be found within their local Michigan Works American Job Center. That includes job matching, training, access to apprenticeships, mentorships, barrier reduction, looking at ways in which we can lower or eliminate some of those barriers to employment that we just previously spoke about: childcare, housing, transportation, retrieving vital documents. But that really helps individuals in that recovery journey, but it also helps individuals re-enter stable employment, which, as we know, is one of the key markers to a pathway toward economic self-sufficiency and resiliency. And again, those services are available through every local Michigan Works office, but the 3 local Michigan Works agencies specifically that received funding through the U.S. Department of Labor back in 2021 and 2022, they were able to stand up different programs that were able to assist individuals that were facing opioid addiction. For example, there was one individual who was a mother of 5. She overcame substance abuse and homelessness before losing her job, but unfortunately, she did lose that job eventually. But she did turn to her local Michigan Works agency for assistance, and through an opioid life coaching program that the local Workforce Development Board was able to stand up as a result of this funding from the U.S. Department of Labor. She received resume support, job search assistance, interview coaching, and she also got help in enrolling college. She was eventually offered 4 jobs, but she ultimately took a position as a community-based peer recovery coach at Catholic Human Services. And I think that is one of the many success stories that we saw through that partnership with the U.S. Department of Labor and the Michigan Department of Labor and Economic Opportunity, but also with the employer as well, that saw the vision that we were trying to achieve, and they were able to offer full-time employment. And now she continues to be a peer recovery coach at that employer in her own region.
Thank you for that context. I know just across the work that we do with family caregivers, that peer support is so critical. So I can see the through line there. John, I'll toss it over to you to share a little bit more about Keystone Contractor Association work and your work fostering recovery-friendly workplaces.
So as you know, in this industry, if you don't work, you don't get paid. And for decades, our government and our healthcare system would just, throw pills to the workers. You got pains. Construction is a tough business, tough industry. It's physically demanding. And like I said, you don't work, you don't get paid. So it was normal, years ago, just to pop some pills and show up for work the next day and keep working. When I came on board at the KCA in 2016, I did a state tour, driving all around the state, talking with training centers, meeting apprentices, talking to the contractors. And a reoccurring issue kept popping up as far as opioid usage, and there was even some moving towards heavier stuff, heroin and stuff, after they couldn't get the prescription anymore. So, I saw like a real issue, a real problem. And I know I'm not the smartest person in the room when I walk in a room. So I thought we got to get a solution here somehow. So I called a lot of smart people I know, a lot of safety directors in construction across the country. And, they said some advice, look here, blah, 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 and they ended up pointing at National Safety Council. And they said, well, just start there, talk with them. So Claire and her team, they're awesome to work with. They're awesome to deal with. Started with NSC, and then through that relationship and that partnership, built something within the safety directors, and we really got a lot of resources out to construction companies to get to their workers. And the one thing we started with was a little sticker that goes on your prescription and your medical card, and it says "Opioid warn me." And you would not believe the door of communication that this opened. Now, most people think, okay, you see a sticker, you show it to your doctor one time, you're not pulling that card out every time you go there. But it is the way it's delivered to the worker. It is the president of the company or the safety director or the CFO, someone of authority within the company, giving it to the worker, saying, here, I want you to put this on your prescription card. I want you to give some copies to your family members as well. And here's some info on opioids. Here's some stats. This is really hurting our industry. It's hurting our communities. And just that small little gesture, that small little token of giving them the sticker really opened the lines of communication and really did some great stuff within the construction industry.
Absolutely, especially when we talk about medication adherence and the role that family caregivers can play in that step of the process. I think next, and definitely want to make this a conversation, so anyone feel free to jump in. But we want to talk about partnerships and how organizations can partner with healthcare plans and policymakers to support individuals in recovery. John, I'm not sure if you have any context on your end through Keystone Contractors or not, but
yeah. So as far as the employment EAPs, so during COVID, we really did a lot of outreach to members to see what advice, what help, what people needed, what workers needed. And we were stunned that how many workers didn't realize they knew they had an EAP, they didn't know the number, didn't know any details or anything. So once we found that out, we made a big push, a big educational push to the employers to say, hey, you're paying for this service. This is part of your healthcare service, so make sure your members know about it. So that was step one, just making sure that workers know they have it, And then as far as policymakers, we've been working with policymakers forever. Much like Ryan said, clean slate. We have that in Pennsylvania as well, and we're trying to work and improve it every year. So there was some major legislation passed, I believe, 2 years ago, and we're trying to fine tune it. Pennsylvania is kind of unique, or maybe every state's like this, I don't know, but they kind of push down the requirements, clearance requirements at the local level. So the state doesn't want to address it. So each school district has their own clearance requirement, and we're looking for uniformity because contractors want uniformity in the hiring process. So it really helps. How can you be recovery friendly if you don't know the rules of the game? So we need to make good rules for the game and then make sure everyone understands them. And I think it all adds up and all helps the process.
Ryan, as far as private public partnerships and funding playing a role in recovery, how do you see that from your point of view?
Yeah, as I shared during our initial conversation, Chance, the best thing that I think we do as a workforce system, and again, I'm going to focus primarily on the employment aspect for purposes of this conversation, that integrated services component within the local workforce system. And I know Pennsylvania has a similar setup with their local workforce boards as we do in Michigan as well. But those integrated services are so vital because we don't want there to be any wrong door to access services. All of our local Michigan Works offices around the state of Michigan, they are well integrated, not only with employment services to get people into a job as quickly as possible, a job that is aligned with their skill sets and their educational experience and also their interests in in-demand employment within the region, but they're also well integrated with other community partners that have vast benefits to offer individuals who may be dealing with difficult circumstances in life. We talked about the barrier removal and wraparound services that are often a key component of an individual's pursuit for a sustainable job. And oftentimes that is a connection to a local community partner who may be able to assist those individuals overcome life's circumstances that oftentimes we are thrown, unfortunately. I think also with those integrated services, as well as those strong public-private partnerships, collaboration between state departments, philanthropic groups, local businesses, recovery organizations, and their local workforce development boards, at least here in Michigan, that's been extremely beneficial for helping individuals along their addiction recovery and journey. Those ties have, in our opinion, really enabled innovative programs and unique services to come about through the local workforce development board. But it truly is a partnership. Workforce development is a team sport, and we need to ensure that within those integrated services, those community-based organizations are playing a significant role in helping to stand up more public-private partnerships.
That's really good context. Claire, I'd love to hear any thoughts you have on partnerships, but I also want to shift gears a little bit and talk about common misconceptions about hiring or retaining employees in recovery, and how do you help organizations overcome that?
Sure. Yeah, I can kind of briefly touch on both. I think John and Ryan added a lot of valuable input on the partnership side, and I'll just say that you really can't do this work without partnerships. I think from a content perspective, we never want to recreate the wheel because there's so much great resources that exist. It's just a matter of connecting folks to those resources. There's a lot of dense material, so trying to figure out ways that we can really help to amplify the work that's already been done, to make it digestible, to make it accessible, I think is really the key area that we're focusing in. And then also looking to help employers understand that partnering with local community offerings and state offerings is going to be the most impactful route that they can take, because we have trainings to help fill in gaps. But at the end of the day, if you can have an organization come in and speak to the impact on your community, the resources that are available in your community, I think it just is so much more miles effective when you can get everybody together to create those connections. So I think that's something that is really valuable in this conversation. From a misconception standpoint, there are many. I think I mentioned that we do a lot of research at NSC and a lot of surveys, and in one of our recent surveys, we saw that, which was positive, we saw that a lot of employers, about, I think just north of 80% of employers, felt that there was really opportunities and need for supporting individuals struggling with substance use disorder. But on the flip side, in the same survey, if you ask that same group of employers, how they viewed opioid misuse, they thought it was a kind of a fireable offense if there was opioid misuse. So we're not seeing the connection with the tangible policies and procedures that need to happen in the workplace in order to really build that supportive environment to really make that happen. So I think lots of more work that we're trying to do to create those resources. And I think from a broader perspective as well, a lot of employers just don't think this issue is impacting their organization. So a lot of folks might turn a blind eye to this conversation because it's so stigmatized. We've talked a lot about that already. So just kind of taking it one step at a time to meet people where they're at and give them data and information that can help them maybe reconsider the employees that might be struggling within their organization. And I think storytelling is such an important piece of that. I think the story that Ryan told earlier about the woman who was able to kind of go through their process and find a career path and really be successful in that career. I think it's really helpful to highlight all of those instances and also to share information with employers about the impact that it has, of course, from our perspective on the safety outcomes. So I think those are some areas that we're really trying to dig in more to help draw some of those connections.
That's super helpful context. I would also just add, like, through the caregiver lens and navigating employee benefits, I think that's one area where oftentimes the caregiver may play a role in helping to understand what those benefits are and also navigate that depending on what that sort of relational dynamic looks like. Ryan, I want to come back to you and talk about policies that you've seen successfully advance recovery services in your state. Where do you see the caregiver's role in providing that support?
Issues and initiatives like our Clean Slate initiative statewide has done a marvelous job of expanding access to services. And so from the caregiver standpoint, right, I think it's about understanding what are those resources available for the individuals that you are a caregiver for, your loved ones, those that may be in your community. So having access to, but also an awareness and understanding of those resources like Clean Slate, who to talk to, what individuals or organizations that you should be connecting with in order to understand some of the sometimes complex nature of programs and services. But there are people here in Michigan and around the nation that have similar setups, like in Pennsylvania, for example, on those Clean Slate initiatives. Their sole reason for their occupation is to help individuals along that recovery journey and make sure that they have access to resources and services that are going to get them back on their feet, back into employment, back into a sustainable life. And so as a caregiver, I think that's extremely important. We have to make sure that we are not leaving any population behind when we're talking about the needs of employers, but also the needs of job seekers in Michigan, and standing up different resources and programs that meet the realities that we are seeing on the ground to better assist individuals who may be struggling. How can we get them on a pathway toward resiliency and success? Many of those integrated services and legislative items that we are pushing here in Michigan will make access to those services that much easier.
Thank you. That was super helpful context. Before we close out things today, I want to sort of ask each of you for words of advice or a piece of advice that you can leave caregivers and caregiver advocates watching this webinar today with. Claire, I'll start with you.
Sure. Yeah, Chance, I think you already alluded to this, but I think organizations and employers are just an untapped resource overall when we're looking for avenues for support for individuals struggling, whether you're the caregiver yourself and you're looking for support to relieve some of that burden, some of the stress, the chaos that life can bring, or whether you're an individual that has a substance use disorder. I think they're an untapped avenue to providing that support. And we're thankful that more employers and organizations are seeing that as an opportunity for themselves to amplify that. So really just looking for better ways to find the information from organizations on what those benefit offerings are and what those resources look like. I know John was talking about EAPs. A lot of folks don't know that they're there. A lot of folks don't know that they're free or confidential. So just taking some time, wherever little you can find it, to look at whatever organizational support resources that you have to better utilize those, and also to advocate for them within your communities and organizations within your community.
Ryan, any words of advice for caregivers and caregiver advocates?
Similar to Claire, especially the last few comments of hers, that advocacy piece is so critical. I would say don't be afraid to ask questions. I know that oftentimes, especially as a caregiver, the circumstances that you are dealing with may seem overwhelming. And honestly, sometimes the systems in order for you to navigate successfully they're complex, sometimes unfortunately by design, but really advocating sometimes really means asking those critical questions, making sure that you are communicating with other community partners and resources that you have at your disposal. There are people out there that are wanting to help, that really use this as their life's purpose in order to be able to assist individuals that are struggling with difficult times. And so don't be able to advocate, or don't be afraid to advocate in order for you to be able to ask critical questions to get the resources and the support that you also need as a caregiver in order to deliver that maximum impact that we all know you can.
John, any last words that
Yeah.
you would leave caregivers or caregiver advocates with?
Yeah, I would say much like 2016 when we started with the stickers, you just got to start the conversation, and it should be top down. So if you get the employer or the owner showing that this is an important initiative, important issue, it really can be impactful and helpful. And along the lines of what Ryan just said is people want to help. I was just blown away when I started making phone calls saying, hey, we got this issue. And then not only here, I think you should do this, talk to this person too. I think there's so many resources out there, organizations, associations, companies, consultants. Once that floodgates opens, I was just blown away. I have a guy from Seattle calling me, Boston, people all over say, hey, talk to this guy. So it's been awesome.
This is great. Thank you, each of you, for the perspective and the expertise that you've added today. I think the work that you're doing at the National Safety Council, Michigan Works, and Keystone Contractors Association is really important as we advance so much of this work. So thank you for joining us here at Caregiver Action Network. To those tuning in, we will be following up with these resources and also looking to integrate those into the FAM Network website. So thank you, everyone.
Thanks for joining us today in this important conversation during National Recovery Month. We've heard powerful insights about how recovery is not only possible, but sustainable when individuals have the right access to treatments and support, whether it be at home, in the workplace, or throughout their communities. We all play a critical role in creating environments where people feel understood, valued, and supported. I encourage you to take what you've learned today and carry it forward, whether by offering support to a loved one, shaping workplace policies, or advocating for access to treatment innovations like long-acting injectables. Together, we can create a world where recovery is celebrated and where healing is within reach. Be sure to check out Families, Addiction, and Mental Health Network to learn more and access the resources discussed throughout this webinar. We hope to see you soon.